Hey, it's Peter Morley, your patient advocate, and I'm so honored to be here with my good friend, Congressman Joe Morelli of New York's 25th district. I always have to remember that. And I wanted to ask you today, Congressman, a lot of people have been very concerned, including your constituents, I'm sure, about the upcoming cuts to SNAP and Medicaid that are going to begin January 2027 from that big ugly bill that was passed last year. I know Nebraska and Montana have already implemented them. And also, just as an aside, there have been 14 maternal units that have been shuttered with about 150 or so that are on the brink of being shuttered, creating maternal healthcare deserts. Just considering all that, how can we stop this from happening, or what can we do?
Well, I think there's two different things that I'm working on. The first is to educate people about the choices that have been made in this Congress by this president. And so the people, when they go to make their decisions in November and going forward, they'll be equipped with some understanding of what is actually happening. That's number one. Second is to be able to, and in doing that, to push back. I mean, we're clearly pushing back against this, and I want to just take a minute or two to talk about what's happening. And then the second thing for me is I'm leading an effort in my hometown in Rochester to make sure that people subjected to the new rules, SNAP beneficiaries, Medicaid recipients, that we give them every opportunity, first and foremost, to determine whether they're the so-called able-bodied people that are the targets of the new requirements. And then if they are, first of all, if they're exempted, it eases their mind that they don't have to comply. But if they're not, and they are targeted here, then making sure they have the resources to be able to comply with all the requirements so that they don't lose benefits. I mean, so if I could go to the first part first and then just talk a little bit about how we can help people. First and foremost, when the president and his colleagues say that there's waste, fraud, and abuse, they actually don't believe it, and there's nothing that they're doing that's intended to get at that. That's, frankly, I hate to use the word, it's a complete lie. It's a fabrication. It's a distraction. What they're really trying to do, Peter, is move money away from people who are struggling with nutritional deficiencies, people who are struggling with inadequate health care, people who are literally on the edge financially to be able to pay for these things. And they're going to burden them more so that they could do two things. One, continue to increase funding for the military and defense world, and the president is continuing to conduct, in my view, an illegal and incredibly expensive, ill-advised war in Iran, which is cost, by some estimates, $140 billion or so, money that easily could have been spent and should have been spent to support people on SNAP and Medicaid beneficiaries. So that's one group, and one thing is to bolster defense spending, which the president has recommended, by the way, in the current year go from $900 billion to $1.5 trillion, a $600 billion increase in defense spending to conduct his war, despite how dramatic the American people are in their disapproval of that war. So he's doing it even though the American people are heavily objecting to the war. But the second group that he's really trying to help is billionaires and the wealthiest people in America. And by the way, they get the benefit of the big, beautiful bill without even doing anything. So the people who struggle to have food and adequate health care, who are at the lower end of the economic scale, are being required to jump over these hoops, required to fill out more paperwork, more burdensome requirements to get what they already have. And the wealthiest people in America get a tax break and have to do nothing to get it. They don't have to create another job. They don't have to build a factory. You don't have to do anything, and you get a big tax break. That's where the money's going. So it's disgraceful. And by the way, we don't even have as much money as he's spending, so we had to go out and borrow and add to the federal debt somewhere in the tune of $4 to $5 trillion. I mean, it is. If someone wrote this down and suggested make a good novel, no publisher in their right mind would publish. They'd say this is the craziest thing ever. It could never happen, but we're living through it. So we're going to continue to push for enhancements to our healthcare system, whether you're on Medicare, Medicaid, whether you get private insurance through the Affordable Care Act. That's all a big part of what we're going to do. Second thing is we need to make sure that we're developing tools to be able to screen people and help them through this. And by the way, Peter, it's not going to stop at SNAP and Medicaid. Yeah. Literally going forward, every single person who benefits from some federal government service is going to be compelled, I'm sure, this is my prediction, going to be compelled to go through all kinds of hoops to get the money, because he's trying to throw them off. He's trying not to reform the program, not to make it more efficient, not to make it better, not to make it more comprehensive. He's really trying to do a gotcha. You didn't fill out the paperwork, you didn't do this, we're throwing you off SNAP, we're throwing you off Medicaid. And in some cases, it could be years before you're allowed to reapply. So this is just really dark and cruel and inhumane, and I don't know how to best summarize it. And frankly, I don't even know how to put a good spin on it.
Well, I just wanted to add something too when you're talking about a gotcha. For Medicaid, the redeterminations are going to be twice a year as opposed to once a year. And that a lot of people are not aware of this. And that in itself is a cut. And, you know, the people that need assistance with it, if people move, I mean, there's just so many ways that people can get cut off from it. And as you said, it can sometimes take a while to become part of the program again. And there is no retroactive pay. And when it, like, personally for me, I'm on Medicaid and SNAP, and Medicaid pays for my prescriptions,
right,
which cost about $150,000 a year for all 38 of them. And I'm so grateful that it does through a program called Extra Help through my Medicare. So Medicare and Medicaid are very closely related.
Right.
So I am so thankful and grateful for these programs, but if I lost that program, I would never be able to afford to pay for the medications.
Well, I don't think there's any question, Peter. This is sobering, and people don't want to hear it. People will die because of this. People literally will die. They'll certainly get sicker. And, you know this is certainly true, that whether you have health insurance or not, let's say you don't fill out the paperwork. You don't know that the paperwork has to be done now twice a year. You don't, it is a gotcha. It's intended to discourage you or to make you make a mistake so that you fall off the program. But that doesn't mean you're healthy. All that means is you can't get primary care, you can't get screenings, you can't get drugs. And what happens? Ultimately, you end up in a long line at an emergency room where it might take hours and hours for anyone to see you. You'll be sicker, and it'll complicate the mission of our healthcare systems, because they're going to be clogged with people who otherwise, had they been covered by health insurance, would have seen a doctor earlier, would have been able to get care. So there's no question about it. This is intended to hurt people, but it's all about saving money, and not by saving money by making a better program, saving money just by having fewer people enrolled. And the only way you do that is put up obstacles and barriers to coverage.
I mean, for the inflation on SNAP alone, I mean, there's no increase to the cost to SNAP, and there have been cuts to SNAP already. I mean, a basic item like orange juice has doubled in price, and sometimes for for, in some areas tripled in price.
Yeah. And
So
that's all driven too by the whole war effort in large part. Certainly the price of gas, which is then complicates the transportation of goods like food, which drive up the price of food. I mean, this is a president who came into office promising he was going to cut the cost of living for people and now acknowledges that he doesn't even think about it while he's thinking about sending billions of dollars to the fight in Iran, where we've accomplished virtually nothing. Again, it's deeply unpopular. This war is more unpopular than I think Vietnam at the height of the unpopularity of the Vietnam War. That's how badly Americans view this, and it's having enormous impacts on people every single day. So the second part is, though, I do think, when this started happening, I pulled together my local community leaders and said, in my region, I'm going to have fewer people drop off Medicare, or rather Medicaid, and SNAP benefits than any other place in the country. So we've developed a screening tool. It just goes through and asks a series of questions. At the end of it, it says, congratulations, you're exempt. You don't have to comply with it. Or alternatively, you are one of the people who has been targeted. Here are the following resources now so that we can make sure that you don't lose coverage. So we've been screening thousands of people through this tool that we've developed in Monroe County. So I'm grateful. But, I say to my friends who are protesting and doing all that we can, this is the new reality, though. Until we can change it, we have to give people the resources and the tools to be able to make sure they can be successful in retaining their privileges and retaining their eligibility for these programs. Otherwise, we're going to have really dire circumstances. So I'm hoping that communities around the country are taking very seriously the need to screen people and get them the resources so that they can be successful.
Well, we need more members like you that are going to do that. If every member did that, I think less people would fall through the gaps. But if we had more members like you, the bill never would have passed.
Well,
So to
I
begin
suppose
with,
that's true.
so
Yeah.
yeah. But thank you so much. Thank you for doing that. Thank you for sharing that. And thank you so much for your advocacy. You're just an amazing human.
I would say right back at you, man. You're living it, and you have taken your lived experience and shared it with people to illuminate the challenges that folks face. It's easy sometimes, I think, for all of us who don't experience some challenges to forget that they exist, that other people are living it, and you don't just live it, once a week. You're living it every day, every moment of every day. You know the hardship, and the fact that you've taken that experience and use it to help other people, which you do on an ongoing basis, I think is remarkable. So my hat's off to you. Thank you for everything you do.